Yesterday, Lindsey Vonn, who was supposed to make a comeback as a skier after 5 years of retirement at the age of 41 and just a week after tearing her ACL, broke her leg in this fall and was airlifted by helicopter. In English, they call this a hero or zero situation. Either you come out a hero or a zero, meaning a huge failure. Let's understand exactly what happened there, why she competed while injured, and how dangerous it is. But let's start with who Lindsey Vonn even is. Vonn is one of the legends of alpine skiing, with dozens of victories in competitions around the world and 3 Olympic medals. She retired from the sport in 2019 due to injuries and returned 5 years later. And she's not just another athlete, but a sports legend trying to make a historic comeback and close the circle. Now, to understand just how unusual her story is, let's look at the injuries she's endured in the past. In 2013, at the World Championship, she tore her anterior cruciate ligament, her MCL, the medial ligament, and suffered a fracture in the tibial plateau, the upper part of the shin bone. In 2014, she suffered another injury in the same spot after taking a very hard hit that prevented her from participating in the Sochi Olympics. In 2015, she broke her ankle. In 2016, she broke her right hand. And in 2018, she sustained another significant injury. She suffered a tear in the lateral collateral ligament (LCL) in her knee, tears in the meniscus, and another fracture in the tibial plateau, which required a complex surgery that ultimately led to her retirement. After retiring, she spent 5 years without competing, and then she decided to make a comeback. Just a little over a week ago, during a competition in Switzerland, she fell, tore the anterior cruciate ligament, ACL, in her left knee, along with meniscus tears, and suffered a severe blow to the knee, and yet she chose to compete in the Olympics. Now let's try to understand if it's even possible and why she chose to compete while so injured. First of all, her age. Vonn is 41 years old, and this Olympics isn't just another opportunity, it's her last chance. Anyone who has seen her compete and speak understands that she is a true athlete through and through, and she simply can't not compete as long as she's able. The third reason is that she knows every inch of this course and feels she can handle anything that comes her way. The fourth and final reason is that she can do it, and it sounds strange considering she's only a week out from such a significant injury. But basically, if the knee is stable and strong enough, it's possible to ski with a torn ACL. You can also play soccer with a torn ACL, and we've seen examples of that. Basically, the ACL helps stabilize the knee front to back, preventing the shin from moving forward relative to the thigh. But if the knee is stable enough and our muscle response is good enough, it's definitely possible to play competitive sports without an ACL. It's a bit strange just a week after an injury, but in general, it's possible. But in the end, Vonn's competition didn't end the way we would have wanted it to. So let's understand why it's a bad idea to compete in such a condition. As we said, the cruciate ligament helps stabilize the knee, and when it's not there, there's an increased risk of the shin moving forward and backward over the thigh, which can cause knee instability and lead to further injuries. And if we look closely, we'll see that under her tights, she was wearing a knee brace. Now, obviously, I didn't examine Vonn, and I don't know what her condition was between the injury and the competition, but if she chose to compete, I believe she knows what she's doing and that her knee was stable enough to do so. Now, if we really analyze the videos, you can see that she has a bit of a protective response on her left knee, meaning she absorbs more load with her right leg by landing earlier on the right to protect her left knee, which indicates a change in her skiing technique, and this could lead to injury. Now, I'm not an expert in skiing, but it seems she didn't enter the turn well, tried to correct in the air, but didn't have enough momentum, and that's why she crashed. Another important point when we talk about returning from injuries is that pain is not really a reliable indicator. Adrenaline, medications, and injections can reduce the pain, but they don't actually restore stability and confidence to the joint. This is one of the dangerous things when we talk about returning from injuries. Athletes tend to assess their condition based on pain and not really according to the tissue's ability to bear load. In the end, Vonn crashed, was evacuated by helicopter, and we received the report that she broke her leg, underwent surgery, and is in good condition. That's all. We don't know exactly where the fracture was, what kind of surgery she had, or if there were any accompanying injuries. So was it worth it for her to take the risk and compete? In hindsight, it's easy to say no, but I'm trying to look at things from a slightly different perspective. If I were her physiotherapist, would I have recommended that she compete? Medically speaking, clearly not. The knee isn't stable enough, there are probably still fluids there that further interfere with stability, and the brain wants to protect the knee, so the mechanics change and the risk of injury increases. But, and this is an important but, her spirit and her desire to compete were so strong, and in the end it's her decision and the insurance companies. Bottom line, Vonn's story is one of a bit of irresponsibility, but a lot of passion for sport and a desire for a heroic closure. Sometimes we just don't get the sweet, shiny Hollywood ending, but rather a painful and difficult reality. Take care of yourselves. Good luck.